Symptoms and pain improve even more. Now there's flare-ups. They're about once a year, and the pain's about a 3 to a 5 out of a 10. You can see just constant progression as this individual got to the source of the problem and started healing and providing the body the most basic building blocks. We get constant progression. So what could have been done different? As I took you on this journey, well, you can see that this individual was looked at the level of the joint. By a rheumatologist, diagnosed with the sacroiliitis with the chronic inflammation. Then had the symptoms of the fatigue, the anxiety, all the other things. Was sent to the PCP, put on the anti-anxiety medications. Well, what could have been done different is that this could have been investigated further, taking more time, digging into this history. And if that would have happened, you would have found out from the age of 10 to 31 years old, this individual suffered from severe digestive issues, but this was never looked at. Also, from that time, 10 years old to 31 years old, fatigue, lack of mental clarity, difficulty concentrating, and lack of coordination. Again, what do we have an interplay here of the GI tract, of the immune system, and the nervous system all coming together in one individual? And that explains why we have all the different symptoms. Here is research backing up why this individual made so much progress and why this inflammation is happening at the level of the gut and goes to the joints and the brain. We have our molecular mimicry. I'm going to show you a picture that depicts that very well. Right here. So what we have right here is the amino acid sequence of bacteria and amino acid sequence of our self-antigens, whether that's at the level of the joint or collagen itself. And some of these chronic inflammatory diseases, these autoimmune diseases, they are attacking collagen in the joints or brain tissue itself. But what happens in molecular mimicry is we have the gut bacteria. We talked about how that disrupts the GI lining. That produces the chronic inflammation. That produces these autoantibodies. Well, these autoantibodies, not only are they triggered to attack that gut bacteria, but then they're triggered to attack our own tissues. And again, you can see on there, that's because our tissues and these gut bacteria share a very similar molecular sequence. So these autoantibodies, they think our tissues, they think it's the bacteria. But again, that's happening at the level of the gut. And it says here, antibodies are produced in extra-articular regions. That just means regions other than the joints. Articular is the joints. And where are these extra-articular regions? Again, that's at the level of the gut, such as the enteric mucosal lymphatic system before gaining entry into the joints, binding the synovial tissues, and that comes from the gut flora, causing gut inflammation. World Journal of Gastroenterology research article here, again, talking about how TNF-alpha, remember that pro-inflammatory cytokine being produced at the level of the gut from intestinal permeability. Treatment of rheumatic manifestations of inflammatory bowel disease. Well, rheumatic diseases usually are attacking the joint, happening at the level of the joint. Our IBD there is our inflammatory bowel disease. They are integrally linked, our rheumatic conditions and inflammatory bowel diseases. But again, it doesn't have to be overt inflammatory bowel disease where you're experiencing the digestive issues. Remember, we can have that subclinical gut inflammation too, where you've got inflammation in the gut, but not necessarily the digestive symptoms. The problem is here, and what this research article talked about, is a lot of the treatments for these conditions, these chronic inflammatory or autoimmune conditions at the level of the joint, whether that's corticosteroids or NSAIDs, they themselves damage the gut. That causes chronic inflammation. That will make it continue to persist. So the very treatment that's trying to stop these conditions is actually causing the inflammation that's allowing these conditions to perpetuate. And again, that's why that individual made progress being able to get off of those medications. Again, healing the gut, stopping that chronic inflammation at the source. Here's more research talking about NSAIDs, that they don't stop the joint destruction, but actually what they're doing is producing small intestine damage, which again is perpetuating that chronic inflammation. And it shows here, if we modulate that intestinal flora, if we feed the good bacteria, if we can replace with good bacteria, that has an anti-inflammatory effect, and most of all, improves the quality of life. And that's what this individual started to experience more and more of as time went on. How many individuals you know have a chronic condition and they increasingly get better? I don't know too many. Most people have the condition, whether on medications or not, and they increasingly get worse. Well, this individual increasingly got better.